Everybody, this is Dr. Gita Mathai and this is my Health Vibes channel. Today we are going to talk about a very common problem, which is diarrhea. Everybody gets diarrhea at some time in their lives. There is no need to panic if you have an attack of diarrhea and go rushing to the doctor. Most diarrheas will become alright within 2 or 3 days and you can very well tackle it at home. Diarrhea usually happens because you have eaten something which did not agree with you, or you got an attack of food poisoning. You can say, I heated the food very well, so I can't possibly be contaminated with anything. When you heat the food, you kill the bacteria and the viruses, but the toxins that they release remain in the food and those are not destroyed by heat. What exactly is diarrhea? So for some people, passing motion 5 times a day may be normal. For other people, only once a day is normal. If you pass motion 3 or more times more than you normally do, then this is diarrhea. And please remember that diarrhea and dysentery are not two words that can be interchanged with each other. Dysentery means there is blood in the stool. Diarrhea means the stool does not have any blood but is more watery than what you normally pass. The best way to tackle diarrhea is to take equal quantities of parboiled rice and moong dal, put it in a pressure cooker, add salt and cook it very well. Then mash it, add water and make it of a semi-solid consistency. Take 2 teaspoons of this and eat it every half an hour. If this is very boring, then you can also eat yellow bananas. Do not have fruit juices, do not have gulab jamuns and do not have any milk or milk products. If you get dehydrated, then you have to go to the doctor immediately. The signs of dehydration are urine which is more high colored than normal and looks like concentrated tea, less urine than normal, and feeling of fatigue and tiredness. You should also go to the doctor if there is bloating, vomiting, or severe abdominal pain. If the diarrhea doesn't subside with this within 3 days, please go to a doctor. Any diarrhea that lasts for 2 weeks or more may not be due to any bacteria, but may be due to some other disease like thyroid disease or some tumors or many other causes, and they need to be investigated. If a diarrhea is due to food poisoning or viruses, antibiotics will not work. And the antibiotics that you take will only make your diarrhea worse because it will change the normal composition of your intestinal bacteria, the good bacteria which are beneficial to your body. Many Indians are lactose intolerant, which means that they really cannot tolerate large quantities of milk. So when you get diarrhea, you should immediately cut the amount of milk that you drink. But remember that partially digested milk like curd may be well tolerated. Diarrhea in children is very dangerous and very often children can die from diarrhea. To prevent diarrhea in children, continue breastfeeding till the age of 1 year. Breast milk protects against diarrhea. Do not use feeding bottles or pacifiers. Diarrhea in a child has to be immediately shown to a physician. There is a virus called rotavirus which causes dangerous and fatal diarrhea in children. Attacks of this virus can be prevented with immunization. Please give your child 3 doses of rotavirus before the age of 1 year. This is Dr. Gita Mathai signing off. If you liked what you heard, please subscribe to my Health Vibes channel and press the bell button. The same content is available in Tamil. Thank you.